Okay, hello and welcome to the Iowa Community Corps Performance Measures Training. My name is Erin Hardigree. I manage the Iowa Community Corps AmeriCorps program, and today we are going to learn all about our performance measures, what that means, and how we report them. So just to provide a quick overview of how our program is funded, because that informs how we track performance measures, our program is funded through both an AmeriCorps state and national grant. Again, that's funded through AmeriCorps, the federal agency, and so those are federal public funds. And then 30% of our funding comes from the Youth Mental Health Corps grant. This is a private grant made available to us through the Schultz Foundation. It's a 2-year pilot program. And our Youth Mental Health Corps is a cohort within our existing Iowa Community Corps program. And there are multiple youth mental health corps programs in the state of Iowa and across the country. So there are 2 different grants that we have performance measures for that we have to track and meet throughout our service year. So really quickly, I want to provide an overview of our program goals and objectives because that informs how we track our performance measures. So the Iowa Community Corps has the goal to build capacity for organizations across the state. So our goal is that organizations will have improved capacity to serve communities in the areas of food security, resource navigation, and youth mental health as a result of AmeriCorps service. We also have a goal to engage community members through volunteerism to increase the overall impact of our members' service projects. And then our last goal is to grow and strengthen the community health workforce through intentional training and hands-on experience. So those are our program goals. That's the what we aim to do, and then our objectives are how we intend to meet those goals. So we plan to place 36 AmeriCorps members at 20 host sites across the state of Iowa. Once our members are placed at those host sites, they will support capacity building projects to expand, enhance, and improve programs and services at their host sites. And then we also will engage volunteers. Our members will engage volunteers through training, managing, and volunteer recruitment. And our goal is that our members will collectively manage, train, and recruit a minimum of 100 volunteers. And then our last objectives are to have each of our members follow a professional development plan and complete community health worker training. So that is the intentional training that we provide through our program to ultimately strengthen our community health workforce here in Iowa. So again, I mentioned our goals and objectives of our program really inform what our performance measures are and how we're going to track them. So as an AmeriCorps program that is funded through federal funds from the AmeriCorps agency, when we submit the grant application, we say we apply for federal funds to host an AmeriCorps program. We have to say what our AmeriCorps members are going to do, how they're going to do it, and what performance measures we are going to use to demonstrate that we are, in fact, using those federal dollars the way that we said we were, and managing an impactful AmeriCorps service program. So our performance measures are capacity building, or that's our focus area. So we want to demonstrate that our AmeriCorps members are building capacity at their host sites in a variety of ways. So what it means to Build capacity means that our AmeriCorps members are helping to expand the scale or reach of programs and services. So enabling organizations to reach more community members through their service activities, or helping to make programs and services more efficient or more effective. So there are a variety of ways in which our members can do that, but ultimately their service activities should demonstrate that they're expanding capacity in some way through a variety of activities. So in our performance measures, we have outcomes, outputs, and volunteers leverage. So our the first number, that 20, is the number of organizations that report receiving capacity building services. So that's our output. So that is the immediate result of our AmeriCorps program. So we want to place 20, we want to place our AmeriCorps members for service at a minimum of 20 different organizations. And once they are placed for service, they will have a member position description that outlines their service activities that they will complete at that site. So the way that we track that initial output is the number of organizations that have an AmeriCorps member enrolled for service with capacity building activities in their position description. So that's our immediate output. Our outcome is more of that long-term impact, right? So our outcome is that of those 20 organizations that have members completing capacity building services, at least 18 of those organizations will report expanded capacity. So we want to place members at a minimum of 20 host site organizations to complete service. And then of those 20, we hope that at least 18, if not all 20, will report that capacity was expanded at their organization in XYZ ways. And then the last performance measure is the volunteers leverage, and that's 100. So that's the number of volunteers that we aim for our members to either recruit, train, or manage. So I don't expect every individual AmeriCorps member to recruit, train, manage 100 volunteers, but as a whole, collectively, that is the goal, that we will reach that 100, if not exceed that number of volunteers. So how do we measure capacity building? Capacity building is can kind of seem like a subjective or ambiguous term because there's so many different ways that you can build capacity at an organization, and that's just it. Each organization has unique needs. Each of our host sites has their own unique programs and services that they provide. They have their own populations that they serve. So there are a lot of different ways that our members can build capacity for these organizations. So when we are tracking these performance measures, each site defines what those capacity building measures are going to be. So if you look back on your member position description, you'll see that your capacity building activities are written into your position description. So you'll see you have, clear projects that are outlined there. Those are your capacity building projects. So as long as you're making progress on the projects that are outlined in your member position description, then we can feel confident that you're building capacity. But we do have to track that by collecting quantitative and qualitative data along the way. And each site, again, will define what those measures are going to be. So it could be the number of resources that you create throughout your service term. It could be the number of events that you coordinate. It could be the number of partnerships that are established, or the number of individuals served or systems developed, or it could be a combination of these different measures. But ultimately, each site needs to demonstrate at least, some key metrics to provide data that capacity building is taking place as a result of the member service. So as far as tracking capacity building, this is ultimately the responsibility of your site supervisor. So your site supervisor has to complete a progress report at the middle of the member service term and then the end of the service term. So they will be kind of reporting your capacity building activities. They'll provide some data to back up the various ways that you are building capacity. And so they probably have an idea of what those metrics are that they are currently tracking or will be tracking. But that may take some coordination between the two of you to make sure that you are systematically tracking those activities. So you should, maybe at your next one-on-one, sit down and talk about your capacity building activities and what makes sense to track. So if your service activities are very much focused on community engagement, then maybe you want to track like the number of events that you're hosting or the number of individuals that you're reaching. If your service is much more focused on resource development or systems development, maybe you want to track the number of resources that you're developing or trainings that you're holding. So again, it's ultimately the responsibility of your site supervisor to report your capacity building activities, but it may take some coordination between the two of you to make sure that you are systematically tracking those activities. The next performance measure that you should be tracking is the number of volunteers that you're engaging with. So you should have a volunteer tracking spreadsheet, and we're going to go through this spreadsheet right now. So volunteer tracking is the responsibility of the member to keep track of, right? Because that's something that you may be doing on a day-to-day basis. And so each time, each occurrence where you're engaging with volunteers, we want you to be keeping track of that so that we can get the most true and accurate numbers when it comes to the number of volunteers that our members are collectively engaging. So start now if you haven't started already and just read through these instructions. So this volunteer tracking spreadsheet, there's 3 sheets on it. The first sheet is the cover sheet. So that's just going to provide some instructions on how to track volunteers. And then you'll provide your name, the name of your host site, and then the total number of volunteers that are recruited, trained, or managed by you, and then the total number of hours that those volunteers served. So make sure some things to just make note of here is that you don't want to duplicate volunteers. So volunteers should only be counted once, but you do want the total number of hours. So if they volunteer with you on multiple occurrences, you'll want to make sure that you're tracking that so we can get that total number at the end of each reporting period. And also, you're only going to want to count the volunteers that you are actually responsible for. So these are the volunteers that you are actively engaging with. So volunteers that you've recruited directly, that you've trained, that you've managed, supervised, coordinated. It shouldn't just be volunteers who are volunteering when you happen to be there or at the organization in general. It should be volunteers that you are actively engaging with as part of your AmeriCorps service. So just make sure that you're being intentional about the volunteers that you're tracking. So the next sheet is the actual volunteer tracking sheet. It's pretty straightforward, but you'll see you want to list the volunteer's name. So you'll list their first and last name. If you don't have their first and last name, or if you don't want to list their first and last name, you want to provide at least some sort of unique identifier. so that we're not duplicating volunteers. So provide a unique name or identifier, and then you're going to start tracking their volunteer hours. So if they volunteer with you one time, you'll list the number of hours that they volunteered with you. If this is a recurring volunteer, and they've volunteered with you a second, third, or fourth time, you're going to want to track the number of hours that they spend with you at each occurrence so that we can total that number at the end and get the total number of hours. So I have provided up to 10 occurrences here for each volunteer, but if you happen to exceed that number, if you have a volunteer that's coming more than 10 times, that's okay. Just add an additional column for each occurrence so that we can get, the most true and accurate value for that total number of hours. So you'll be doing this tracking throughout your service term. And then when we get to when it comes time to submit your first progress report, you're going to want to take the sum of the number of hours for each occurrence so that you can get the total number of hours. You should have, a handful of volunteers listed here, if not more. And so then once you've got all of your volunteers listed, you'll take the total number of hours and then sum that for each volunteer so that we can get the total number of hours across all of the volunteers. So those are the two national performance measures that we have. These are the performance measures that we have to reach to fulfill our AmeriCorps national performance measures. So our federal grant, these are our performance measures. So there are 2 times that these need to be reported. The first is April 15th. So you and your supervisor will be tracking your performance measures from the start of service through March 31st of 2026. And those will be submitted in the initial progress report on April 15th. And then the final report is due September 15th. And at that point, you and your supervisor will report your national performance measures from the start of service through August 31st or your end date, if your end date is earlier than August 31st. So keep in mind in both of these progress reports, what you will be reporting on is both your capacity building activities and the volunteer tracking. So I would encourage you, if you have not already actively started tracking performance measures, to, at your next check-in with your supervisor, talk through your performance measures so that you both have a plan for how you will be systematically tracking both your capacity building activities and the volunteers that you're engaging with. Okay, so those are our national performance measures that all of our AmeriCorps members have to report on as part of their AmeriCorps service. And then I also mentioned earlier that part of our funding also comes from a private grant, and that's our Youth Mental Health Corps grant. So we have a subset of our AmeriCorps members that fall within the Youth Mental Health Corps, so not all of our members are in the Youth Mental Health Corps. But those members will have additional reporting requirements and training requirements in order for us to fulfill the requirements of the Youth Mental Health Corps grant. So if you're not a Youth Mental Health Corps member, then you can stop the recording here. But if you are a Youth Mental Health Corps member, keep watching because we're going to go through the Youth Mental Health Corps requirements, both training and reporting requirements. And if you're not sure if you're a Youth Mental Health Corps member, go look at your member position description. It will be listed right there. It will say that you're a Youth Mental Health Corps member, and you should have some specific Youth Mental Health Corps activities listed in your member position description. Okay, so as I mentioned, The Youth Mental Health Corps is a cohort within the Iowa Community Cohort. It is a national initiative. There are multiple AmeriCorps programs across the country that are receiving funding through this Youth Mental Health Corps grant and are leveraging existing AmeriCorps programs to be able to build up this additional cohort of AmeriCorps members who are supporting youth mental health through their AmeriCorps service activities. So in order to fulfill the Youth Mental Health Corps requirements, first, the host site that the member is serving at has to serve youth between the ages of 13 to 24. They have to be a school or community-based organization, and they have to have organizational capacity for mental health supports. So this is very broadly defined, but the host site needs to meet these eligibility requirements, and then the member needs to be a U.S. citizen, lawful permanent resident, or U.S. national between the ages of 18 to 24 years old. They need to be from or near the community that they're serving, and they need to pass the AmeriCorps background check and have Youth Mental Health Corps activities in their position description. So the Youth Mental Health Corps activities are intentionally very broad. This is a new pilot program, and so the funders wanted to allow for a variety of mental health core potential activities in order to engage youth in a variety of capacities and allow for creativity and innovative approaches to supporting youth mental health. So look through your position description. Again, you will have youth mental health core activities listed into your position description. So it may not be everything that you're doing. It may not be the entire focus of your position description, but you should have at least one project in your position description that has a youth mental health core focus. So just some examples of those activities would be creating, updating, translating outreach materials for community supports, hosting or participating in community outreach or wellness events, assisting with intake and referral activities under supervision, conducting youth-led needs assessments, asset mapping, provider and partner outreach, or community engaged research related to mental health. You could be hosting group or peer-led workshops for social and emotional support, or designing and delivering mental health and wellness prevention activities for specific groups. And that is just some of the potential youth mental health core activities that our members might be engaging in. So as a member of the Youth Mental Health Corps, there are some additional requirements. So all of the members need to complete the survey within the first 2 weeks of being enrolled in the program. So if you have not already, you should be receiving that link soon to complete that survey. And then the Youth Mental Health Corps members need to complete some foundational mental health training. We'll talk about that in a bit. Complete some career coaching, and then there's also additional reporting. Youth Mental Health Corps members also have the option to participate in some additional activities. These are not required, but are definitely activities to support you in your professional development, and you're encouraged to participate them, and you can log your time for them if that's something you would like to do. So there are monthly member check-in calls with all the Youth Mental Health Corps members across the country. So that's an opportunity to network with other members in this area. There are also monthly webinars that you can attend, and then I'll provide a calendar of these events at the end of the slideshow so that you can see when the next opportunity is coming up and attend if you would like to. Okay, so first requirement is that Serve Minnesota survey. So this here must be completed within the first 60 days of your service. It also has to be completed at the end of your service, so within 30 days of exiting the program. And then you'll receive a follow-up survey 6 months post-service that will have to be completed as well. So the goal of this survey is to track, your knowledge of youth mental health and your impact from the start of service to 6 months post-service. The first one was sent out on October 6th, and it will be sent out as members continue to be enrolled. So just make sure you're keeping an eye out for that survey and getting that completed when it becomes available to you. The next requirement is the community health worker training. So all of our AmeriCorps members, both youth mental health and non-youth mental health corps members, have to complete the public health training for community health workers. This training is all about resource navigation. So it's 11 modules. It takes about 10 to 20 hours to complete, and each module focuses on a different area of public health here in Iowa. So there's one on food security, there's one on Medicaid and healthcare, there's one on oral healthcare, maternal health. So it really kind of dives into what the specific health issues are here in Iowa and what resources are available to help people get the support that they need. And then the second training, and this is specific for youth mental health corps members, is the youth mental health for community health workers training. So that's a 1-hour training that should be completed within the first month of service. So both of these trainings need to be completed within the first month of your service. These are online trainings. They're asynchronous, so you can complete it on your own time. So I would just recommend that you're spending, about in that first month of service, at least 5 hours per week on these trainings in order to complete them on time. And then youth mental health corps members also need to complete the mental health first aid training. So this is offered through Iowa State University Extension and Outreach. It's an 8-hour training, and it results in a certification. So you will be mental health first aid certified by the end of this training. It's available in person or online. If you do the online option, there are 2 hours of self-study. So 2 hours of pre-work that you'll have to do prior to attending the virtual training, which is live. So there'll be other individuals attending the training with you in a virtual setting, and that is 6 hours long. So we're actually partnering with Iowa State University to offer a mental health first aid training session to our AmeriCorps members only, and that's going to take place on January 10th of 2026. That's on a Saturday because we have a lot of members who are in school or have another job. So we wanted to be able to offer it on a Saturday to be able to accommodate as many folks as possible. So make sure that you get signed up for that training. If you're watching this recording and it's past January 10th, we will have another opportunity, or you can go and sign up for your own training. So you'll click on the link here and then click on upcoming events, find a training that's available when you're available, sign up for it, and just make sure that you use the code MHFA25 so that you don't have to pay for the training up front. That way the invoice will come to us and then the program will pay for the training. So 2 options here. You can do the group training with all of the other AmeriCorps members, or if you're available during the week when one of the upcoming trainings is happening, you're welcome to sign up for that as well using the code here. If we will likely have another group training offered on another Saturday for some members that might enroll into our program at a later time, perhaps in like March or April. So more information on that to come. Youth mental health corps members also have access to career coaching, we require that our members meet with a career coach at least 3 times. But you're welcome to meet with them more often than that if you would like to. That's an additional benefit of serving in the Youth Mental Health Course, that you have access to career unlimited career coaching. So you should receive a text from your career coach to get started, and they'll work with you to get signed up and get your first sessions scheduled. And then again, for our program, we want you to meet with that coach at least 3 times, but you're welcome to meet with them more often than that. Okay, so now for performance measures. We are required to report on the following measures. So the number of Youth Mental Health Corps members that we enroll in our program, the number of members that complete the certification pathway. So our certification pathway is the community health worker training, the youth mental health for community health workers training, and then the mental health first aid. So those 3 trainings need to be completed in order to fulfill the certification pathway. So important that you complete all 3 of those trainings before the end of your service term. We also need to be tracking the number of youth served within the caseload, and we'll talk more about these specific definitions later, and then the number of community members served outside of the caseload. So those are the 2 metrics that we need to track. And then lastly, we need to provide some narrative, so some qualitative information to describe the Youth Mental Health Corps activities. So the number of youth served within the caseload is essentially the number of youth between the ages of 13 to 24 that engage in the structured outreach activities that are outlined in your member position description. So if you're not sure what that is, take some time to read through your member position description and highlight those Youth Mental Health Corps activities. So you should have some structured outreach activities listed in your position description. That could be workshops with youth, it could be group sessions or meetings, presentations, community events, or it could be kind of one-on-one peer mentorship, one-on-one support. So within your caseload means that it's youth that are completing the activities that you have listed in your member position description. We only want to count individuals once per service term. So we'll have to be sure to remove any duplicates before we submit the final report. And the goal for tracking the youth within the caseload is that this is, we're wanting to provide the most precise and accurate number here. So we want to be really intentional about tracking the youth within the caseload and making sure that we're including all the youth that are engaging in these structured outreach activities. But we also want to get an idea of the number of community members that have benefited maybe indirectly from the program, but who have been touched by the program in some way. So the secondary measure for Youth Mental Health Corps is the number of community members that have been served outside of the caseload. So this can be community members of all ages, doesn't necessarily have to be youth. So it could be parents of youth, it could be teachers or community members who interact with youth. It really could just be any community member that's engaging in Youth Mental Health Corps activities. So again, this is individuals of all ages outside of the caseload. This means all individuals engaging in informal outreach. So this could be a spontaneous or casual interactions, drop-ins or informational sessions, resource sharing, or just unstructured time spent with youth during your service activities. So for example, say you are tabling at an event. We would want you to try to keep track of each of the individuals that you're engaging with. Or if you are, say you go host a workshop, and then you have someone reach out or follow up with you outside of that or after the event, we want you to do your best to count those individuals as well. So again, really just any activities that are not the structured outreach activities in your member position description, but are still related to youth mental health, we want you to do your best to track. Now, this is a really rough estimate because that's much harder to track, but the Schultz Foundation really just wants to have, a general idea of how many community members are being touched by the program, and not just youth, but are being impacted in some capacity. So I don't want you to stress too much about tracking the community members served outside of the caseload. This is really just like, do your best. If you have someone follow up with you to talk about a presentation that you gave or something along those lines, then do your best to track those individuals when you're able. Okay, so I've created a reporting tool to help you track this and try and make it as easy on you as possible. So that's the Youth Mental Health Core reporting tool. There are 3 different sheets within this Excel spreadsheet as well. So the first sheet is just the cover page. You're going to want to list your name, your title, your host site, and then provide a very brief overview of your youth mental health core activities. So whatever your specific projects are, just maybe 2 to 3 sentences on that. And then there's some key definitions in here to help you in your tracking. So first is youth. We define youth as individuals between the ages of 13 to 24. We consider individuals served to be any individuals that the member interacts with, regardless of age, through structured or unstructured outreach activities pertaining to youth mental health and well-being. So that's how we're tracking individuals served. And then structured outreach would be referring to planned and organized activities such as workshops, group sessions, presentations, or community events. And then unstructured outreach would be spontaneous or casual interactions such as drop-ins, informal check-ins, or general resource sharing. So make sure that you're familiar with those definitions because you're going to have to refer to those when you're doing your reporting. So you should, have a strong understanding of what's considered structured versus unstructured outreach. This report is due at 4 different times throughout the program year. So Q1 report is due December 15th, 2025. Q2 is due March 15th, 2026. Q3 is due June 15th, 2026. And Q4 is due September 1st, 2026. And you'll submit this just by sending it to me in an email. So each report, the reporting period for each report is listed here. So it will be the data that you collect from the start of service through the end of each reporting period. So the data that you report will be cumulative over time. Okay, so this is what the actual tracking sheet looks like. So this is how we're tracking the individuals served. So you'll see some instructions here. You'll want to fill out this form after each structured or unstructured youth mental health core activity. So again, we aren't wanting you to track this for every single AmeriCorps activity, because again, you might, in your position description, every member has their own unique position description. You're all doing different things. But you have, you have various capacity building projects that are listed in your position description. Some of them are youth mental health core related and some are not. So you're only going to want to track for the basis of this reporting tool, the youth mental health core activities. So when you're tracking these, try your best to collect the names and ages of each individual, particularly for those structured activities. It might be a little bit harder to do that for the unstructured activities, and that's okay. If you don't know the name of an individual, make sure to give them a unique identifier. So that can just be a number that you can tie back to that individual so that we're not duplicating individuals. And then you'll need to indicate whether the individual falls within the youth age range or not. If you're unsure, use your best judgment, but you'll list the individual's first name, their last name, or unique identifier. List the date that the activity took place. You'll want to indicate if they're between the ages of 13 to 24, so that's just a yes, no option. You'll select either yes or no. And then what's really important is that you're accurately selecting the type of youth mental health core interaction. So when you're filling this in, you'll see a drop-down menu come up and there'll be different options here. So you're going to want to choose the best fit from these structured and unstructured outreach options provided. So you'll see structured one-on-one, structured group session or meetings, structured community events, workshops, or presentations. And then if it falls outside of those structured activities, then it would be considered an unstructured activity. So drop-in or informal conversations, resource sharing, or tabling. So again, track the individuals, the date that the interaction took place, if they fall within the youth mental health, the youth age range, and the type of interaction. So do your best to choose the best option here. And then in addition to that, for each reporting period, you're going to want to provide one example or story. You can provide more than one if you want to, but you should provide at least one. So that can be, maybe a presentation that you gave, the impact of that presentation, or what took place in that presentation. It really can be whatever example or story that you want to share. We just want to have some qualitative information to back up the quantitative data that we're reporting. So we ask that each member report at least one example or story for each quarter. If you are serving and maybe you haven't served any individuals yet. So again, it's possible that as you're starting your service, you may have not gotten to your youth mental health core activities yet. Maybe you're working up to it, or maybe you're developing resources that are ultimately going to be used for structured outreach activities, but they have not yet. You can include that as your example or story. So, we have one member who has a big event that they're coordinating, but that event's not going to take place until the end of their service. But they're doing a lot of work on the back end to prepare for that. So they may not have any individuals to report in that initial, in the individual tracking list, but you could still provide some information on the resources that are being developed and the work that is going into that community event that's going to take place at a later time. Or if you haven't served, if you haven't done any of your youth mental health core activities yet, because it's something in your position description that we've set up to happen at a later time, that's okay too. We just want you to provide some information to back that up. So fill it out for each quarter that your service falls under, whether you've done youth mental health core activities or not, or whether you've directly served individuals or not. We still want to just have a general idea of how you're making progress on these activities. Okay, so those are the reporting requirements. If you have any questions, you can always schedule a meeting with me. We can look through your position description, highlight those activities, make a plan for tracking, go over the tool together. I'm happy to do that. So just please reach out at any time. These are the optional youth mental health core activities. So this is the monthly gathering calendar. So every month there's a monthly gathering. And this is just an opportunity to connect with other members. There'll be different skills that are focused on with each session. It looks like you'll have 1 hour of skill building and then 30 minutes of community building. So 1 hour focusing on that skill, and then another 30 minutes where you'll get to network and engage with other members. So if you would like to participate in those, you should receive an email with directions on how to get signed up to attend those. And then there are also these professional skill building meetings as well. So here are the dates. You can find the dates in the bottom row below. They're about 60 minutes long, and each is focused on, again, a different topic area in the areas of mental health. So just another great way to build your knowledge of mental health, build your skill set, and I would encourage you to attend if your schedule allows. You can log that time on your timesheet under training. Okay, so that is all that I have for today. Thanks so much for participating. And again, if you have any questions about any of the performance measures, please reach out to me. I'd be happy to schedule a one-on-one meeting so we can talk through any questions that you may have. Okay, thanks.